Osteomyelitis. The best treatment options. Osteomyelitis is an infection in a bone. Infections can reach a bone by traveling through the bloodstream or spreading from nearby tissue. Infections can also begin in the bone itself if an injury exposes the bone to germs. In children, osteomyelitis most commonly affects the long bones of the legs and upper arms. Adults are more likely to develop osteomyelitis in the bones that make up the spine. People who have diabetes may develop osteomyelitis in their feet. If they have foot ulcers. Once considered an incurable condition, osteomyelitis can be successfully treated today. Most people require surgery to remove parts of the bone that have died, followed by strong antibiotics, often delivered intravenously, typically for at least 4 to 6 weeks. Symptoms. Signs and symptoms of osteomyelitis include fever or chills, irritability or lethargy in young children, pain in the area of the infection, swelling, warmth and redness over the area of the infection. Sometimes osteomyelitis causes no signs and symptoms or has signs and symptoms that are difficult to distinguish from other problems. See your doctor if you experience worsening bone pain along with fever. If you're at risk of infection because of a medical condition or recent surgery or injury, see your doctor right away if you notice signs and symptoms of an infection. Causes. Most cases of osteomyelitis are caused by Staphylococcus bacteria, types of germs commonly found on the skin or in the nose of even healthy individuals. Germs can enter a bone in a variety of ways, including the bloodstream. Germs in other parts of your body, for example, in the lungs from pneumonia or in the bladder from a urinary tract infection, can travel through your bloodstream to a weakened spot in a bone. In children, osteomyelitis most commonly occurs in the softer areas, called growth plates, at either end of the long bones of the arms and legs. Infected tissue or an infected prosthetic joint. Severe puncture wounds can carry germs deep inside your body. If such an injury becomes infected, the germs can spread into a nearby bone. Open wounds. Germs can enter the body if you have broken a bone so severely that part of it is sticking out through your skin. Direct contamination can also occur during surgeries to replace joints or repair fractures. Complications. Osteomyelitis complications may include bone death. An infection in your bone can impede blood circulation within the bone, leading to bone death. Your bone can heal after surgery to remove small sections of dead bone. If a large section of your bone has died, however, you may need to have that limb surgically removed to prevent spread of the infection. Septic arthritis. In some cases, infection within bones can spread into a nearby joint. Impaired growth. In children, the most common location for osteomyelitis is in the softer areas, called growth plates, at either end of the long bones of the arms and legs. Normal growth may be interrupted in infected bones. Skin cancer. If your osteomyelitis has resulted in an open sore that is draining pus, the surrounding skin is at higher risk of developing squamous cell cancer. Tests and diagnosis. Your doctor may feel the area around the affected bone for any tenderness, swelling or warmth. If you have a foot ulcer, your doctor may use a dull probe to determine the proximity of the underlying bone. Your doctor may order a combination of tests and procedures to diagnose osteomyelitis and to determine which germ is causing the infection, such as blood tests. Blood tests may reveal elevated levels of white blood cells and other factors that may indicate that your body is fighting an infection. If your osteomyelitis was caused by an infection in the blood, tests may reveal what germs are to blame. No blood test exists that tells your doctor whether you do or do not have osteomyelitis. However, blood tests do give clues that your doctor uses to decide what further tests and procedures you may need. Imaging tests. X-rays. X-rays can reveal damage to your bone. However, damage may not be visible until osteomyelitis has been present for several weeks. More detailed imaging tests may be necessary if your osteomyelitis has developed more recently. Computerized tomography, CT, scan. A CT scan combines X-ray images taken from many different angles, creating detailed cross-sectional views of a person's internal structures. Magnetic resonance imaging, MRI. Using radio waves and a strong magnetic field, MRI scans can produce exceptionally detailed images of bones and the soft tissues that surround them. Bone biopsy. A bone biopsy is the gold standard for diagnosing osteomyelitis, because it can also reveal what particular type of germ has infected your bone. Knowing the type of germ allows your doctor to choose an antibiotic that works particularly well for that type of infection. An open biopsy requires anesthesia and surgery to access the bone. In some situations, a surgeon inserts a long needle through your skin and into your bone to take a biopsy. This procedure requires local anesthetics to numb the area where the needle is inserted. X-ray or other imaging scans may be used for guidance. Treatments. The most common treatments for osteomyelitis are surgery to remove portions of bone that are infected or dead, followed by antibiotics. Hospitalization is usually necessary. Surgery. Depending on the severity of the infection, osteomyelitis surgery may include one or more of the following procedures. Drain the infected area. Opening up the area around your infected bone allows your surgeon to drain any pus or fluid that has accumulated in response to the infection. Remove diseased bone and tissue. In a procedure called debridement, the surgeon removes as much of the diseased bone as possible, and takes a small margin of healthy bone to ensure that all the infected areas have been removed. Surrounding tissue that shows signs of infection also may be removed. Restore blood flow to the bone. Your surgeon may fill any empty space left by the debridement procedure with a piece of bone or other tissue, such as skin or muscle, from another part of your body. Sometimes temporary fillers are placed in the pocket until you're healthy enough to undergo a bone graft or tissue graft. The graft helps your body repair damaged blood vessels and form new bone. Remove any foreign objects. In some cases, foreign objects, such as surgical plates or screws placed during a previous surgery, may have to be removed. Amputate the limb. As a last resort, surgeons may amputate the affected limb to stop the infection from spreading further. Prevention. If you've been told that you have an increased risk of infection, talk to your doctor about ways to prevent infections from occurring. Reducing your risk of infection will also reduce your risk of developing osteomyelitis. In general, take precautions to avoid cuts and scrapes, which give germs easy access to your body. If you do get any cuts and scrapes, clean the area immediately and apply a clean bandage. Check wounds frequently for signs of infection.